Do you know what meningitis is? Ever heard of an inflammation that can wreak havoc on the delicate membranes surrounding your brain and spinal cord? Well, that's precisely what meningitis is. Meningitis is a potentially life-threatening inflammation of the meninges, the protective layers that encase our brain and spinal cord. This inflammation is most commonly caused by viral or bacterial infections, but it can also stem from other medical conditions, certain drugs, or even injuries. Now, you might wonder, how do these bacteria or viruses manage to reach such a critical and well-protected part of our body? Good question. They can be transmitted through coughing, sneezing, close personal contact, or in some cases, they are already living dormant in our bodies, waiting for a weak moment to strike. When it comes to symptoms, they can be quite deceptive, resembling those of a flu: fever, headache, stiff neck, light sensitivity, confusion, and in severe cases, seizures might occur. In infants, symptoms can be even harder to detect, often including unusual sleepiness or irritability, poor feeding, or a bulging fontanelle, which is the soft spot on the top of a baby's head. If you suspect meningitis, seek medical help immediately. Early detection is crucial. The doctor will likely perform a lumbar puncture, a procedure where a sample of cerebrospinal fluid is taken from your spine and tested for the presence of bacteria or viruses. Treatment depends on the cause of the meningitis. If it's a bacterial infection, antibiotics are the first line of defense. Antiviral medications are used if a virus is the culprit. In some severe cases, hospitalization might be necessary to provide fluids, control seizures, or even to reduce potential brain swelling. To wrap it up, meningitis is a serious inflammation of the membranes surrounding the brain and spinal cord, most commonly caused by viral or bacterial infections. Its symptoms can be misleading, often resembling a flu, but they should never be ignored. If you suspect meningitis, seeking immediate medical help is imperative. Treatment varies, ranging from antibiotics to hospitalization, depending on the severity of the case. Meningitis is not something to be taken lightly. Its potential to cause long-term complications or even be fatal underscores the importance of awareness, quick action, and appropriate treatment. So stay informed, stay vigilant, and most importantly, stay healthy.